Hello friends, how are you all? In current critical situation of COVID-19, some of the cases we see people are happy and look like comparatively healthy, and then also doctors declare them as a serious or critical case. How is it possible? Are doctors lying or you are missing something? Is someone able to catch it earlier? Is there any solution? Please look at the screen which I will share with you within a second. Watch it very carefully. Friends, this is a monitor. We use it in our hospital setup, specifically in ICUs, that is intensive care units. It is a continuous monitoring equipment. You can see here 116, it denotes your pulse rate, and 48% it, it is the patient's SpO2, that is oxygen saturation. Isn't it scary? Oh, some of you might not know the seriousness of these figures. Friends, I will explain you the significance of the readings. To know the solution, one should be aware of something called happy hypoxemia. It is also called silent hypoxemia or silent hypoxia. It is just like a silent killer. As the name suggests, it is silent, keeping person happy outside despite low blood oxygen levels. Some patients appear to be functioning well or near to normal without serious issues or even shortness of breath. Here I am not going to scare you. I want to aware you of the situation. You all know oxygen is important for our life. As blood oxygen levels begin to reduce, a person may experience shortness of breath, also called as dyspnea in medical terminology. If blood oxygen levels continue to fall, the organs may shut down and the issue becomes life threatening. We have already seen the meaning of silent or happy. Now, what is meant by hypoxemia? Here, hypo means decreased or less. Hypoxemia or hypoxia is defined as a decrease in the partial pressure of oxygen in the blood. This is very important. A decrease in the oxygen level of blood is hypoxemia or hypoxia. To catch this happy hypoxia earliest, to avoid the life-threatening complications of the condition, to save lives, to avoid helpless conditions of doctors, to live healthy, everyone must know all about pulse oximeter. So today's topic is to know about pulse oximeter. What is pulse oximetry? Pulse oximetry is a test used to measure the oxygen level, means the oxygen saturation of the blood. It is an easy method. It is really a painless method. It can rapidly measure even small changes, how efficiently oxygen is being carried to the parts of your body from the heart, including the extremities, that is legs and the arms. So what are the product features? Product is pulse oximeter. So pulse oximeter is an instrument. It is a lightweighted instrument. It can be carried anywhere. Means it is handy or portable. Manually one can adjust the direction of interface. It is having a color display. Simultaneously it has a display for testing value and plethysmogram. It has a visual alarm function and real-time spot check. It has low battery voltage indicator. It gets switched off automatically, and it has standard alkaline batteries which supports more than 20 hours continuous work. So you have to know now aware of the purpose of the pulse oximeter. So what is the purpose? I repeat, the purpose of pulse oximetry is to check how well your heart is pumping oxygenated blood through your body. Will the use of pulse oximeter limited to COVID-19 only? Will it be money wasting after COVID-19 pandemic over? So everyone wants to know what and where is the use of pulse oximeter other than COVID-19. So friends, it may be used to monitor the health of individuals with any type of condition that can affect blood oxygen levels, especially while they are in the hospital, even at home. These conditions include: first is COPD, that is chronic obstructive pulmonary disease; asthma, that is bronchial asthma; pneumonia; lung cancers. So maximum diseases are related to respiratory tract, but some of the conditions of cardiac origin also can have that, can take advantage of the pulse oximeter. Even anemic patient, as we all know, anemia is nothing but oxygen carrying capacity gets decreased in anemic patients. So in those cases also we can take advantage of pulse oximeter. There are a number of different common cases for use of pulse oximetry, including to assess how well a new lung medication is working, to evaluate whether someone needs help in breathing, to evaluate how helpful a ventilator is, to monitor oxygen levels during or after surgical procedures that require sedation, even anesthesia, to determine how effective supplemental oxygen therapy is, especially when treatment is new, to assess someone's ability to tolerate increased physical activity, and to evaluate whether someone momentarily stops breathing while sleeping, that is called sleep apnea. And for patients of sleep apnea, the doctors suggest sleep study, and in that case also pulse oximetry is useful. So how to use it? Everyone wants to know how to use it. Generally, during a pulse oximetry reading, a small clamp-like device is placed on your finger either, or on your earlobe, or you can use toe even, any toe, right or left. Preferably, the best way to do the test is in sitting position. That means you have to be in resting position, and the best finger to use it is the middle finger, and preferably the middle finger of the working hand. Usually we work with the right hand, so right handed people can use middle finger of their right hand. How it works? Everyone wants to know how it works. Small beams of light pass through the blood in the finger, measuring the amount of oxygen. It does this by measuring changes of light absorption in oxygenated or deoxygenated blood. As the name suggests, pulse oximeter is a combination of three words, that is pulse, oxy, and meter. So pulse is related to pulse rate, oxy means for oxygen, and meter is for measurement. The pulse oximeter will thus be able to tell you your oxygen saturation level along with your pulse rate, indirectly your heart rate. So I am going to tell you step by step information. It is always better to perform examination after 6 minutes walk. Make a habit of applying sanitizer on your finger before and after examination. This is very important. Make a habit of make it clean and away from viruses. So step 1 is most commonly a clip-like device will be placed on your finger or earlobe or toe. You may feel a small amount of pressure, but there is no pain or pinching at all. In some cases, a small probe may be placed on your finger or forehead with a sticky adhesive. So here tip for turn the pulse oximeter on and off. Put one of the fingers into the rubber hole of the device. It is best to put the finger thoroughly, the nail upward. Then release the clamp. Press power button to turn on the device. The oximeter will automatically be powered off when no finger in the device for longer than 8 seconds. This is number 2. Step number 2 is keep the probe on for as long as needed to monitor your pulse and oxygen saturation. To monitor physical activity capabilities, this will be during the extent of the exercise and during the recovery periods. Even during surgery, as I have already said, doctors use it for continuous monitoring till the end of surgery, even for post-operative care. The probe will be attached beforehand and removed once you are awake and no longer under supervision. This is step number 3. Once the test is over, the clip or the probe has to be removed. Here tip is that for longer utility of device, it is always better to remove the battery cells of the device and reinsert it before using it next time. This is important. Thus, battery life and indirectly device utility can be enhanced. So which pulse oximeter to buy and why? So this is very common question. Pulse oximetry is typically a fairly and accurate test. This is especially true when using high quality equipment found in most medical offices or hospital settings. So try to buy quality equipment as the treatment plan will definitely depend on the reading. How to interpret the reading? It is important to know it consistently provides results within a 2% difference either way of what it truly is. This is for your knowledge. It is for an example. If your reading was 82%, your true oxygen saturation level may anywhere between 80 to 84. Means 82 minus 2 and 82 plus 2. That is range from 80 to 84. However, the quality of the waveform and assessment of an individual must be considered. Factors such as movement, temperature, or nail polish can impact the accuracy. And I have already told you that you have to take it in resting position. A temperature maintenance should be there, and there should not be nail polish on your nail. Can one use individual phone as a pulse oximeter? So the iOX is a smartphone pulse oximeter compatible with Android and iPhone devices from Safeart. The device is plug and play and requires simply downloading the iOX application available on iOS and Android devices. But medical experts don't suggest this method, at least for now, that is corona crisis or COVID crisis. What are the two readings on a pulse oximeter? Till now you might have understand which are these readings are, but I am repeating this. So these two readings are SpO2 and pulse rate. So SpO2 is the percentage of hemoglobin in the blood that is saturated with oxygen. In simple words, it is your oxygen saturation level. When oxygen saturation is measured using a pulse oximeter, it is referred to as SpO2. And another value is pulse rate, that is heart rate. What is a good reading on a pulse oximeter? So normal pulse oximeter reading usually ranges from 95 to 100% for SpO2, that is oxygen saturation, and values under 90% are considered low SpO2. Here is a tip for current scenario of COVID-19. So SpO2, that is oxygen saturation below 95% is alarming. Don't wait till the saturation drops down up to 90%. Those are theoretical values, and practically in COVID crisis, the outcome may vary if patient reaches the hospital late. So below 95, you have to go to doctor for hospitalization. So it is always better for you and treating doctor to get time to start treatment in time. And as we all know, stitch in time saves 9. So which cautions and how to maintain life of device? Keep the operating environment free of dust, vibrations, corrosive or a flammable material and extremes of temperature and humidity. Do not operate the unit if it is damp or wet because of condensation or spills. Avoid using the equipment immediately after moving it from a cold environment to warm or humid location. Never use sharp or pointed object to operate the front panel switches. The batteries must be taken out from the battery compartments if the device will not be in use for long time. The device shall only be used if the battery cover is closed. The batteries must be properly disposed according to local regulation after their use. How to clean the device? This one has to know. Cleaning to be done as follows. Switch off the power. Take out the batteries before cleaning. Keep the exterior surface of the unit with a dry and soft cloth. Use 75% density of medical alcohol to clean the surface. Use dry fabric, means you can use cloth with a little alcohol to avoid permeates into the device. So cautions while cleaning. Don't use strong solvent, for example acetone, just like nail paint remover. Never use an abrasive like steel, wool or metal polish. Do not allow any liquid into the product. Do not immerse any parts of the device into any liquids. Avoid pouring liquids on the device while cleaning. Don't keep or remain any cleaning solution on the surface of the device. Make it dry. Whatever you are using, make it dry. Nowadays, made in India devices are also easily available. Most of them have 6 months to 1 year warranty. So I feel every house should have their own device so that they can take health advantage of it. Will be sure about the safety precautions that can be free from contamination and problems of transfer of infection carried by multiple handling can be avoided. So please like my video, share it, comment on this. Don't forget to subscribe if not subscribed yet. I wish you healthy, wealthy, wise, happy, long life. A big thank you each and everyone. Thank you.